So, welcome everybody to the Survivorship Lecture Series. I am today's featured speaker. I'm board certified in preventive medicine and public health, and I'm part of the cancer prevention and survivorship team at the University of Illinois Cancer Center. I also provide comprehensive clinical care to cancer survivors and those at risk at the University Village Family Medicine Clinic. But I'm involved also in educational initiatives that disseminate knowledge and awareness of survivorship to staff at UIC, trainees, as well as the community. And I have special interests in cancer prevention, survivorship through cancer risk assessment and reduction, healthy lifestyle promotion, integrative medicine, and genetic testing for cancer predisposition. But today I will talk about that interest in the lifestyle medicine. And sorry, y'all see on my screen. I will go ahead and share. So that is the topic of today's talk. There's a lot of buzz about this lately in the medical community. Um, and it is something you can certify in if you're so interested in this area. You can become a diplomat of the American College of Lifestyle Medicine. So, objectives of this talk today are to define and briefly give a history of lifestyle medicine, learn the various dimensions of this field, and how these practices can assist our cancer survivors and help us with cancer prevention. And then we'll discuss lifestyle medicine at UI Health, kind of a little interspersed throughout, but we'll have a discussion at the end. So, what is lifestyle medicine? And this is kind of self-explanatory, it seems, but it's kind of all unified. This evidence-based medical specialty with using whole person prescriptive lifestyle change to treat, and when used intensively, can have the power to reverse chronic conditions. It has six pillars: a whole food, plant-based diet, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. All of these things all wrapped up helped prevention for conditions, medical conditions that family medicine providers see, but also cancer and cancer risk can be helped greatly. So, using this little infographic from the American College of Lifestyle Medicine, review those six pillars. Again, the nutrition is huge. It's probably number one of most things. Really, this field really believes food is medicine and promote predominantly plant-based foods, which we'll discuss more later. Exercise, advocating for regular and consistent physical activity that you can do daily. And that can really help with conditions. Stress can lead to anxiety, depression, obesity, so immune dysfunction. So trying to help patients become more centered, more balanced, and manage and cope with that stress. Substance abuse, preaching to the choir here: tobacco, alcohol, drugs, etc. Sleep is the linchpin. Lack of good quality sleep can lead to strained immune system, cognition, and more. And then building relationships is essential to building emotional resiliency and improving outcomes. So, brief history: the holistic approaches of going way back in Greece and China, they recognize this importance of diet, exercise, and mental well-being. Oh, hey. But in the 20th century is really when we began to shift the landscape. There was a rise of chronic disease, which highlighted this need for preventive care. Most people have heard of the Framingham Heart Study in 1948, and that was one of the first of its kind of really establishing a link between lifestyle factors and cardiovascular health. But the term lifestyle medicine really was formalized and gained traction as the healthcare arena recognized the need for this structured approach to lifestyle modification. The American College of Lifestyle Medicine, ACLM, was founded in 2004 and still going strong today. It emphasizes the importance of these evidence-based lifestyle interventions, which we'll talk about today. And it's slowly getting integrated into medical practice. It's become more in clinical practice and medical education. This focus on preventive care rather than just treatment. Time and time again, I talk to people who feel that current Western medical care is putting a band-aid on things, masking symptoms, and covering things up. But lifestyle medicine really gets to a little bit more root cause of what medical issues can be associated with. And it's really ongoing. There's tons of research now coming out supporting the efficacy of these interventions. Organizations and medical associations worldwide are recognizing this as a vital component of comprehensive healthcare. It helps manage illnesses and improve overall health and well-being. It's a more holistic approach to patient care, which is what patients nowadays are starting to ask for more and crave, and the satisfaction scores are based on. It also empowers patients to make sustainable lifestyle changes that can lead to a huge impact and make their lives just healthier overall. So again, coming back to these 6 dimensions of lifestyle medicine, this whole food, plant predominant nutrition, regular physical activity, restorative sleep, stress management, avoidance of substances, and positive social connections. I'll get into all of these, but just start with the really true impact of this. 20% of preventable cancers are due to what you see these arrows over: excess body weight, alcohol consumption, poor diet, and physical inactivity. This comes from some research, a huge cancer progress report from the American Association for Cancer Research that they put out that highlights all of these ways that we can prevent cancer and the disparities that exist. Tobacco smoking is its own thing, has another high risk, but it's clear that lifestyle is very important. And you don't see the other ones, sleep, social interactions, on here because they're a little bit trickier to measure. We have found some metrics around being able to measure these things of diet and activity. And according to the American Cancer Society, they go up and say about 50% of cases are preventable. Tobacco being number one, almost 20%. And there's that almost 20%: alcohol, poor diet, physical activity, and excess body weight. They also add in 5% on UV radiation, which is low-hanging fruit, guys. Just tell your patients to wear sunscreen, right? But a huge amount of cases and deaths are linked to these modifiable risk factors. And you can see multiple different types of cancer can be prevented. 100% cervical cancer with an HPV vaccine, 95% of skin cancer if we helped educate our patients. So it's a big field that lifestyle medicine has the ability to help with. And despite all these staggering statistics, a lot of patients have the limited awareness that these cancer risk factors are risk factors. Most Americans on the right, they say tobacco use, yeah. Sun exposure, sure. But only a third of Americans recognize obesity as a risk factor for cancer, even though it's the second leading cause of preventable cause of the disease. And then few Americans actually think that alcohol is a risk factor, and 25%, a quarter of Americans, identified lack of exercise as a problem. And there are really not much that people are doing. About half, a little fewer than half of Americans say they're actually wearing sunblock, limiting exposure to the sun, exercising, maintaining a healthy weight, and limiting alcohol. So coming back to this lifestyle medicine and coming back to how all these different dimensions can assist survivors. Um, I don't need to repeat them again. They're on that slide and it'll form the rest of this presentation. So healthy nutrition, whole food plant predominant diet. And the American College of Lifestyle Medicine recognizes on the left here is what America eats. You see lots of candies, pastries, sugar, 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 fried foods. These things increase the risk for obesity, diabetes, heart disease, as well as some cancers, because this is a highly inflammatory diet, is the basic message. So by going that line from the right to the left to the right, decreasing those sweets and snacks, fast food, fried foods, refined grains, and other things, increasing whole plant foods, vegetables, legumes, beans. So leads to this much prettier, colorful plate that decreases all these risks, right? And decreases the potential for cancer to occur. So they have a whole lot of guides that they put out for children, tweens, kid-friendly, and how to get started on this. We're really coming down to this plate, a whole food, plant-based plate with plenty of fruits and vegetables, drink water, not milk, because dairy has been linked to certain types of cancer, eating plant proteins, and then whole grains. So we know that our intake can influence cancer risk and outcomes. And the evidence is lacking for the benefit of any specific regimen when you get into the research studies. But truly, the main point is focusing on the healthy diet principles and being mindful of what you're eating and trying to eat better, healthier, more whole foods. A study out of the American College of Lifestyle Medicine uh, focused on some case studies, and it was an evidence-based approach to chronic disease prevention and treatment. And evidence just supported this benefits of adopting this mostly whole food plant-based diet. I mean, you can never be 100% of anything. It's linked to a decreased risk of breast cancer and colorectal cancer. This dietary behavior change is key and really is important for all of us to have effective counseling for patients on behavior change. They suggested the 5 A's method, which we learn in medical school as physicians: the assess, advise, agree, assist, and arrange. And I will provide this later with links to all of these papers that I've referenced. Um, and there's a need, again, for evidence-based and practical dietary counseling methods, tools, and resources, all found in this article. So it's a good one to take a look at. Now, the impact of the modern dietary practices on cancer risk and progression. I looked at 23 studies. There are 15 reviewing the Mediterranean diet, for the ketogenic, and for the whole food plant-based diet. They all have the potential to decrease cancer risk and disease progression. They all showed, as the paper said, significant improvement in lowering cancer development, recurrence-free status, and limiting tumor growth were noted across numerous cancer types. Now, I understand it's kind of hard sometimes to keep up with these diets, whole foods all the time, ketogenic all the time. So for our patient population, things look a little bit different, but again, it's those basic principles of a healthy intake. And this is just shown more in this study about the effect of diet on mortality and cancer recurrence among cancer survivors. They took a meta-analysis of 117 studies over 200,000 individuals, and they found that there was a lower overall mortality with increased vegetable and fish intake, decreased alcohol, and a higher quality and a more healthy dietary pattern. No surprise, the Western diet, with all that chock full of sugar and fat, is associated with a higher overall mortality. So I could go on for a whole talk on nutrition and each one of these areas, but I'm going to try to keep it brief because I have a lot of ground to cover. So I'll show you now some of the background that promotes regular physical activity to help with cancer. 7.6% of cancers are due to excess weight. And like I said before, that all those cancers that are related to these modifiable risk factors. And here you can see 15 types of cancer that are related to excess weight. The reds are the cancers associated with obesity. The light blue, as well as the dark blue, are related to physical activity specifically. So it's kind of hard to tease that out a little bit. Um, those due to obesity are probably more due to dietary factors versus those with physical activity are more about a better performance of the system as a whole. So they also, the AACR and these guidelines also reflect multiple other guidelines from organizations like the American Cancer Society, sorry. And they give different recommendations for groups of different aged people. Kids, of course, require a whole lot of activity, but in our adult range, in older adults, 150 to 300 minutes of moderate intensity per week, or 75 to 150 of vigorous and strength training. So that's resistance training. You can use weights, you can use bands, 2 to 3 days per week. And they have a nice insight here that defines the difference between aerobic activity and strength training so that you can be specific talking to patients about these guidelines. But this word exercise, sometimes when we talk to survivors about it, is a little triggering because it's something maybe they used to do that now they can't. And they have such a hard time with that, grappling with that. And how do we expect cancer survivors to exercise when they're dealing with fatigue, they're dealing with brain fog, they're dealing with physical limitations? So it's important to note this difference. Exercise is something structured, like yoga, tennis, swimming, dancing. But physical activity, which we should promote and is a lot more palatable for patients, is any kind of movement. You don't have to run a marathon to benefit from physical activity. And research is showing that moderate physical activity, including walking, protects against weight gain and obesity. So, something we can always encourage our patients to do. And it's important to note that 3 10-minute walks give as much physical benefit as one 30-minute stroll. I talk to patients all the time about this all or none mindset. If I can't go out and walk for a half hour, it's not worth it. But every little bit adds up and take it in chunks. So, and you don't even need to do all that much. Again, it may be tough for survivors, but this study from JAMA Oncology showed that the vigorous intermittent lifestyle physical activity was very beneficial in short bursts. This prospective cohort study of over 22,000 participants, about 62 years of age, a little more female, mostly white, were followed over time. In the vigorous intermittent lifestyle physical activity, VILPA, inversely what was inversely associated with incident cancer risk. And this is more pronounced for physical activity related cancers, as opposed to those that are the obesity related cancers. And they showed that just 4 to 5 minutes of Vilpa daily was associated with a substantially lower cancer risk. And here I just took one of the graphs that they have, this dose response of the Vilpa daily duration, and it's just about 1 to 2 minutes. And you can clearly see that physical activity related cancer incidence going down. So next dimension of lifestyle medicine is sleep. Because we know good sleep improves pretty much everything, right? It makes for better health decisions, easier, more clarity to our thought. It can help with cancer risk management and outcomes, stabilize our mood and emotional responses, enhance the ability to handle stress, and lower the risk of chronic disease. Overall improves all aspects of the quality of life. And this is important when you take a look at cancer survivors who are having such a hard time getting sleep. You can see this infographic from the Cancer Treatment Centers of America is 50% of cancer survivors experience sleep disturbances. I don't know how they differentiate that from insomnia, but up to 80% experience that. There's a great deal of sleep apnea in head and neck cancer patients, up to 80%. And 30% of patients report cancer-related fatigue were diagnosed with sleep apnea. So a lot of things we can easily test for and help with. Cancer patients are 2 times more likely as people without cancer to experience insomnia. And up to 10 years, they have sleep disorders after they're done with treatment. There are many factors that contribute to these sleep problems. There's a lot of stress that these patients have, pain symptoms, side effects of treatment that are causing anxiety or causing physical duress. Schedule changes, medication, and inflammation plays a role in all of this. So, in this article about the association between sleep problems and general quality of life in cancer patients versus general population, they summarized all these results in one sample of almost 4,500 general population folks and 8 samples of cancer patients. These groups span from 36 to about 4,000 patients. And all cancer patient groups had more sleep problems. And they were all associated with worse general quality of life metrics and patient-reported outcomes, higher fatigue, and poor emotional functioning. And it's even worse for female and young cancer patients. They report higher rates of sleep issues. So I'm not going to read through all of this, but I found a nice bank of prostate cancer, have a twofold risk of developing prostate cancer in men with insomnia, 50% increased risk of colorectal cancer for people sleeping less than 6 hours per night. It's a pretty steep statistic. And then in breast cancer, more aggressive breast cancers with higher oncotype scores are associated with inadequate sleep as well. So definitely plenty out there on sleep. Stress management reducing stress to improve well-being is a real huge part of lifestyle medicine. Sorry, hold on. I don't know if who's talking can mute. Thanks, Moss. Okay. Oop. So stress management. I found a couple of studies here and a couple of methods we can talk with our patients about. Mindfulness-based interventions for psychological well-being in men with prostate cancer. So, four studies, including three randomized controlled trials of mindfulness-based interventions, were included in this meta-analysis. And when they used these MDIs with men with prostate cancer, they had improved psychosocial outcomes. They pooled all the results, and the effect on quality of life were pretty good. And post-traumatic growth were large and significant. So definitely an area to research more and research in other types of cancers. I'm sure this is pretty universally helpful. Another interesting note, yoga in cancer care. Review of evidence-based research looked at 138 relevant trials with over 10,000 patients across 20 countries. And most of these studies reported that yoga was associated with improved physical and psychological symptoms, improved quality of life, and improved markers of immunity, which we know plays a significant role in cancer and cancer spread. So there's strong support for yoga's integration into conventional cancer care. And one form of yoga is called breath work. And this is accessible to everyone, and it doesn't cost anything. It's called pranayama, the heart of yoga. Prana means the life force or the breath sustaining the body. And yama is to extend or control. So put together, it's controlling this breath that you have. It has the power to relieve fatigue, anxiety, depression, and it activates the calming parasympathetic nervous system, as opposed to cancer patients who are constantly having treatments or appointments or scans. They need to cut off this sympathetic nervous system response in the fight or flight and turn their emotions to a calming activity. So this infographic here, there's a lot of different yoga breath work that can be done. You don't need to get that technical. But they did a breathing intervention for cancer patients for chemotherapy associated symptoms and quality of life. This was kind of a smaller pilot, but 18 participants completed treatment and they had pranayama during 2 cycles of chemo versus 1 cycle. And again, it was shown this intervention led to statistically significant improvements in sleep disturbance, anxiety, and overall mental quality of life. So we can practice this. Yoga is something pretty easy, and breathing is something pretty easy that patients can learn about. And here is kind of an example of that breathing exercise that's real simple. Everyone can try this right now or at home. I call it box breathing. It's only square when each side is four. So you start at the top left corner and you inhale 1, 2, 3, 4. Hold it 2, 3, 4. And exhale 2, 3, 4. And then rest 2, 3, 4. You can do this anywhere. It's very calming. You can repeat it as desired. A lot of folks recommend 3 or 4 times. This deep breathing really can help to reduce the stress because it activates that parasympathetic nervous system. And it's even a more pronounced effect by extending that exhale period. So if you inhale for just 3 or 4, but you exhale for 6 or 7, you'll start to feel more relaxed. And you can do this yourself, and you can literally feel your heart rate decreasing after doing a couple of deep breaths. So it's a good topic to then move into positive social connections. And this one, again, is a little difficult to measure, but the American Cancer Society Cancer Action Network did this large report on survivor views about social connection during their diagnosis and treatment for cancer. They surveyed a bunch of cancer survivors, just over 1,000, and they all experienced, or not all, but about half of them, a little more, felt socially isolated. About a third of them felt lonely and experienced loneliness. This was exacerbated by their cancer diagnosis and treatment, and it definitely impacted their relationships with other folks, their friends, their family, their coworkers. And they found also that there were disparities in this social isolation. Living alone, race, and lower income were associated with higher rates of loneliness. While connections with family strengthen, isolation from friends and coworkers are more common, which is something I've talked to survivors in clinic about, and that is true. Black, Hispanic, and multiracial are more lonely than whites. And because this was such a comprehensive report, your slide too, there was an impact of cancer on social connections. This diagnosis and treatment, as you can see in this figure on the right side, increased the feelings of isolation for over 50% of respondents. So here you can see an initial diagnosis. The more isolated is the red bar, and it just increased as they started doing treatment. Connections with other survivors, though, they reported was very beneficial by a large majority of patients that were surveyed. A large amount, 89% of those who responded to this survey, though, believed that training for friends and family on how to best support them through this cancer journey would be incredibly helpful. This includes communication skills, ways to offer help, combating misinformation. So we have a lot of work we can do in this area. Just to show the other side of it, there was a systematic review on interventions with social integration components for young and middle-aged adult cancer survivors. They looked at 28 randomized controlled trials that looked at that were on intervention studies that address social integration, connectedness, support, and isolation for young and middle-aged survivors from 18 to about 65 years old. And over a lot of them swung to improving social outcomes, increasing amounts of social support, and decreasing amounts of loneliness. More awareness of available cancer-related resources, and they're feeling more supported, and better patient-reported outcomes among those patients versus the control patients, which is a big metric that we look at in the hospital. So receiving social support from peers through networking sites was associated with improved physical activity. So just giving patients that nudge can definitely help. Forming strong social relationships and maintaining those, they fight those feelings of social isolation and loneliness. And helps the disparate groups especially. It's really beneficial to their quality of life, but they do need a lot of work. So resources like group activities and support groups can be very helpful. So finally, I want to talk to you. I'm sure I'm preaching to the choir on this. Avoidance of risky substances. This is something we talk to all our patients about all the time. But beyond just the lungs, because we know smoking can be seriously bad for lungs, lung disease, lung cancer. There are other cancers that are caused by smoking tobacco as well. In the urogenital system, all the way through it, and in the ovary and uterus, kidney, ureter, and bladder. Throughout the head and neck, cancers are strongly associated with smoking. The digestive system can be affected as well. Of course, the lung and bronchus, but also the hematopoietic system, and it's associated with acute myeloid leukemia. Moving on to alcohol and cancer risk, it again is associated with many different types of cancer. Patients don't realize this. Anytime I talk to someone about the strong link between female breast cancer and alcohol uh, use, they are shocked. So, certain types of head and neck cancer, of course, liver cancer, esophageal and stomach, as well as colorectal cancer. So, hitting that whole GI system as well. So, there are some recommendations. You can Google this, and I didn't include any research on this because they're just papers and papers and papers that show this time and time again that these guidelines for drinking um, that the American Association for Cancer Research published uh, just is validated. If alcohol is consumed, it should be done in moderation. So one or less drink per day for women and one or two or less drinks per day for men. So it all even spells out for somebody how much one drink is. And it goes on to describe heavy drinking and binge drinking. So those are definitely things that we can help patients with to decrease cancer risk. And there's a link between illicit drugs and cancer. Smoking, we know, increases risk of many types of cancer, but also anabolic steroids. Can affect the liver as well as increase prostate and cervical cancer risk. And whatever someone is using, I always, even if it's a recreational gummy thing they get at a dispensary, I always talk to patients about being mindful of where they're sourcing things from because these illicit drugs are subject to less consistent manufacturing processes and can be mixed. They can be laced with carcinogenic chemicals, and you just don't know what's in there. So for everyone though, one note about coffee consumption and cancer risk. I did not mean for this to come up on the slide like this. It is this large narrative review of 105 articles, and there are many studies suggesting coffee consumption decreases cancer risk, but they looked more into the biomedical properties of coffee and kind of theorized on why caffeine, which inhibits TNF alpha, is an antioxidant, may be one of the key components, as well as these other agents that are anti-inflammatory in coffee. I don't know, maybe it's just the drinking extra water during the day too. But coffee, they said that coffee intake is inversely associated with risk of hepatocellular cancer and to a slight extent, risk of breast cancer. I've gotten to know a bunch of the specialists, mostly through Epic chats. And one of our hepatocellular hepatology attendings recommends his patients to drink 3 to 4 cups of coffee because of this association has been shown. Unfortunately, there's not really conclusive results for other types of cancer. The pendulum's always swinging, and the literature is too. And one more in here just to show the adherence to these lifestyle recommendations. Thanks to Jean for this. This study had a goal to see if adherence to these recommendations on the lifestyle from the American Institute for Cancer Research or American Cancer Society before, during, and 1 to 2 years after treatment is associated with recurrence or mortality. So they ran a multi-center prospective observational cohort study of 1,300 women who are around 51 with breast cancer. And the patients with the highest versus the patients with lowest lifestyle index scores experienced 37% reduction in disease recurrence and 58% reduction in mortality. The strongest adherence group had the most significant reduction. This just suggests that this education and implementation strategy is to help patients adhere to these recommendations that are put forth by these major national organizations are worthwhile. So finally, talk about some conclusions and next steps. Takeaways from the talk today. Lifestyle medicine is clearly growing in many different ways with roots in early medical history. In all these dimensions we talked about, the nutrition, physical activity, sleep, stress, social connection, and substances can benefit cancer survivors and decrease risk of developing cancer. Expanding our toolbox helps us help our patients better. So, all good things to be aware of and think about more. In at UI Health, I know there are many ongoing studies. I didn't have time to create a list of all the trials happening at UIC and lifestyle medicine, but it is a growing number that maybe others here can speak to. Wellness House is other as well as other support organizations in Chicago and surrounding suburbs have programs that focus on nutrition, stress management, exercise, and group therapy or group support. There's also, I found this out, YMCA programs for survivors to work with personal trainers that may be offered at a discount. I'm looking into that one. So the question being, should we develop a lifestyle medicine clinic at UIC? And this may need to be taken to the powers that be, because there may be some challenges, the limited visit length, primary care providers don't have all the time in the world to talk to their patients about each of these things. And services and diagnosis reimbursement can be a problem. But this is something that we do in our survivorship visits, but some patients could use a little more help. And just curious if anyone else knows what other services might exist, what other resources we can have. I just wanted to really quickly provide you with all of these large national and worldwide resources so you can take a look at those later if you want. So thanks for listening to me and coming to the lecture series today. And I am so excited to hear what you all have to say. Anyone? Should I start choosing people, Pam?
Hi, Debbie. Thank you so much. This was really a great overview. There's so much out there, right? It can be a little
Right.
overwhelming.
That was hard.
We find this in clinic too, and taking the time to sort of help patients really engage in some of this. I think your idea of expanding access to services that can really spend time with patients to help them dig into a lot of this would be really beneficial because even with the lengthier survivorship visit in clinic, it's still hard to get through all of this, and I think patients aren't aware of a lot of this. I think doctors are really overwhelmed by all of the literature that's out there and don't have a lot of guidance necessarily to really help patients. So having those resources to refer for patients would be really, I think, a benefit for our patients and our providers. I know that this is happening a lot in survivorship clinic, even just thinking about yesterday, right? Supporting their mental health needs, their nutritional needs. They've got a lot of questions. There's so much information out there. They often come in with misinformation. So thank you for helping to make sense of all of this. I'm wondering, the other thing when you said, what else would you like to see in the lifestyle medicine clinic? And maybe this is more in the pain clinic, but also like services like acupuncture and other things that can help our patients with a lot of sort of chronic pain would be really beneficial. I know that the institution is thinking about this, especially the Cancer Center and the OSL, about how to expand those services. So would love your thoughts on that as well.
Yeah, and maybe, I mean, just expanding that into a more integrative therapy type of clinic with acupuncture, mindfulness-based interventions, yoga. There's a lot of evidence behind these improving patient metrics, improving patient reported outcomes. And yes, we have seen just patients love Keisha here on the call. It is so helpful with us in clinic, connecting our patients with resources. So anytime we can find more that can help them, um, you know, on occasion there's a patient that's overwhelmed and not ready for some resources, but in general, our survivors are just hungry for more.
Yeah. And I think, utilizing some of the services that are available through our community organizations like Wellness House and wonderful. It was great to have them in the clinic yesterday and meet some of the new personnel that's going to be helping us and connect our patients to their services. And I'd love, has Keisha introduced herself to the group here? Should we maybe have Keisha, can you come off camera and introduce yourself and talk a little bit about what you're doing in the survivorship program? She may be on a patient call.
Yeah, that's
I can see chats coming up in Epic right now, so she may have stepped away. Anyway, Jean, I see you're off camera. Do you have a question or comment?
yes.
Presentation, nice comprehensive of all the different areas of lifestyle medicine. I was going to say, and one thing, if you don't have much time with the patient, sometimes accessibility to foods, especially when you recommend like diet and nutrition adherence, is challenging. I always tell people to go to Aldi. They have a great selection of all of the foods you would need to adhere to that diet. And sometimes adhering to physical activity guidelines can be a challenge because it's, ACSM, it's 150 minutes of moderate to vigorous physical activity. There's a big movement for exercise snacks, and it's like they just giving like those small bouts of exercise and like reducing your sedentary behavior is like one kind of like small thing you can give them, at least to, if they can't do the full 150 or 2 to 3 times the strength training is challenging per week.
Yeah, I agree. And that was definitely something I was trying to communicate. It's tough, and especially cancer survivors dealing with long-term side effects. All they can handle is a few minutes, Um, but it's worth it, to get that little small snackable type of physical activity. I love it. Hey, Sonia. I haven't
Hey
met
there,
you yet.
everyone. I'm Sonny Williams. I'm the new Director of Cancer Equity here at Wellness House.
Oh,
And thank you. Um, I was really fascinated by, I've done some studies around loneliness after a terminal diagnosis. And I saw that in a presentation that it was even divided out with ethnicities, right? And so some is more exacerbated. Have we found any resources or ways of combating loneliness Because we can be surrounded by people and be lonely, right? And so is that kind of what we're looking at, is kind of just bringing people around one another, or is there something else that we can look at to help facilitate?
Yeah, that would be good research to look into, like what has been effective. I can only theorize, right?
Mhm.
We have connections to so many community organizations, so I think, patients really find it helpful connecting with those social organizations like Wellness House, like, the Alice Wings, like the butterflies, they all have their groups, and you find a group and you feel home, you feel supported, right? And I think that's probably a large part of it. But I didn't actually find or dig into that specific research. Like I said, Sonia, any of these topics could be a whole talk.
Absolutely, absolutely. And in the very beginning, you talked a bit about being certified in this. I think that's awesome. Can you speak more about that, or?
Yeah, the American College of Lifestyle Medicine offers a certification course. I want to say it's 30 hours. I don't know if Pam, you know more about that. I was considering doing it actually, but then my director here prior to Dr. Ganshaw was like, "Oh, you already do this. You don't need to become a diploma in lifestyle medicine." Do you know much about it, Pam?
Yeah, no, I mean, I don't know a ton about it. It is a certificate. There is a certification course. You can look it up. It's ACLM on the ACLM website. And it is, we've had a couple of our preventive medicine residents from Cook County go through that. It's not too time intensive, and it does provide some certification around your ability to do this. I'm not sure exactly what they got out of it, how much more they got out of it. Like, I don't know, Debbie, if you know how much more you would learn from it other than what you've already kind
Right.
of self-taught, right?
Mm.
But it might be worth looking into.
Yeah, I've often been curious, what else is in that training, certification training. So I might explore it at some point. I don't know if I'm sure it's a couple thousand to take the exam for metric
Oh,
site.
this was great. Right?
Great.
So,
And
yeah.
anyone can refer back to this. And yeah, I think that's good. I'll start calling on people too. Tomorrow. Do you have a lot of interaction with lifestyle and your young adult survivors? Would you come off camera and share with us? She's getting there. I don't see her on camera.
Okay, but I can't come off camera because I'm on my phone, but can you hear me?
Yeah, we can hear you.
Oh, okay. Yeah, I mean that all of this stuff is relevant to the work that we do with young women, and we do a lot of nutrition related stuff. We do some exercise related stuff. We do a lot of lifestyle stuff, and just generally talking about risk factors, um, to lower risk factors in young women and then to address like long-term symptoms in young women. And we do it all in connection with community organizations. I mean, I think the hardest thing is that, cancer requires such a cancer treatment requires such a huge commitment that it's hard for people then to make time, find time, to do extra classes, extra engagement. Um, I wonder if like the survivorship clinic could do group visits around some of these lifestyle uh, questions, and that way, if patients saw it as a clinic visit, as part of their medical care, it would be less optional rather than something that another thing that they have to add to their list to do to sort of take care of things while they're also dealing with a cancer diagnosis.
Yeah, that's a great idea tomorrow. Actually, I did run into one article that was talking about group visits. and we it did group visits in tobacco cessation at Cook County Hospital with Frenchen. And it was great because the patients that come to the group visits motivate each other. And while you being the doctor, kind of want to gently approach things, the patients will not hold back. They'll be like, you get on that bike. And so that might be a really great idea to open up a kind of group session like we do group session genetic counseling, Pam. I wonder if we could set up something similar, like you know, 4 6 week kind of little program leading some group sessions on all these different dimensions.
Yeah, I think that's a great idea. I mean, I think we're trying to do that a little bit with like having Wellness House come and do, some of the movement sessions and the mindfulness sessions on site, but actually adding the element of an appointment, like a doctor's appointment to do that might get patients to, you
Right.
know, hear more to that. Or maybe we sort of try to combine forces, right? Do something as a group and then, hand off to some of our orgs that actually are doing this really well. So I
Yeah.
love that idea, Mara.
Yeah, it's really great. All
And
right.
Debbie, we're at 10:01, just so you know.
It is 10:01. So thanks everyone for joining. And you'll see the recording and things up later. So thank you, everyone. Have a great weekend.
Thank you, Debbie.